Okay, so this video is going to be a post-treatment instruction video. And at this point in time, you should have received from us an email that is called the Wean Off email. The Wean Off has specific instructions for many weeks that you have to follow in order to be able to see if you can get off of having to wear the lower mouthpiece. You have to remember, again, the purpose of what we have been doing for the last 6, 7, 8 months, however long you've been doing this treatment with the lower mouthpiece. Before you came in, you had pain in your jaws, whether they were headaches or migraines, vertigo, tinnitus, ear pain, jaw pain. You had some sort of pain, and we most likely diagnosed you with damage to your jaw joint. So if the damage to the jaw joint has been fixed with this lower mouthpiece. And remember, the purpose of the lower mouthpiece was to set the position of the jaws by using the mouthpiece and your teeth to take the pressure off of your joint. If you have cartilage damage, which most likely we told you do, the cartilage has not regrown in your joint, but you have gotten some skin tissue, some fibrous connective tissue, basically some skin tissue, to grow inside that jaw joint. So when you take that mouthpiece out, you'll notice that you really don't want to bite your back teeth together like you did before treatment. So not biting your back teeth together is favorable for you because it doesn't put pressure on the joint. So bringing your lower jaw forward takes the pressure off of the joint, and keeping it there 24/7 has allowed the joint to heal. Now, here's where it's a little tricky. We have well over 95% of our patients that can follow the wean off instructions week by week, remove the mouthpiece as instructed in the email that we sent you and the printed instructions, and they'll find that they can actually stay with their jaws in this new relaxed and healed position and not have to go back to their original biting position and feel like their teeth are physically biting together. They can chew their food, they can swallow, they can talk, they can sleep with the mouthpiece at night and keep things stable. Now, if you try to take the mouthpiece out and you find that you're biting, or you have to feel like you're biting your teeth together, you will return back to the pathologic position where your teeth cannot support the jaw position, and the healing that has happened in there, basically you're going to ruin it. You're going to destroy it. So again, this is an issue of your teeth coming together without the mouthpiece. And a lot of our patients will find that they still have a difficult time when they chew their food because they feel like their teeth have to come together. Now, many of our patients can chew food, keep the food between the teeth, not physically bite their teeth all the way together, and they can live happily ever after without having to get dependent on the mouthpiece. Of course, you will always wear it at night because you don't know what you're doing at night. Now, there's 5 to maybe 10% of our patients that will wean off of the mouthpiece, and after 6, 7, 8 weeks, they find out that they have to return to wearing it because their symptoms come back. Now, if this happens to you and you find out that you cannot function without support from the mouthpiece, now you are entering into a phase 3 situation, phase 3 treatment, where you may have to consider a bite rehabilitation. And bite rehabilitation, again, we don't know exactly what it's going to be. It could be Invisalign orthodontics, it can be reconstructive dental work. There's so many different factors. In order for us to provide those answers, you have to go through the wean off, you have to see how you do, and then you can consider more permanent treatment measures. We have many of our patients that will continue to wear these mouthpieces 60-80% of the time, and they do very well, and they don't mind doing that simply because they don't want to do any other treatment. Now, there are some surgical options that you can consider, even though we always recommend the conservative approaches of either Invisalign or some form of reconstructive dentistry. For those type of things, we need to see dental x-rays, do a complete dental exam, and evaluate where you are at that point in time. So if you have any more questions and you don't understand what the wean-off period, it is important for you to contact us so we can explain it to you. Otherwise, your chances of being able to control your problem are well over 90%, And of course, we're still here for you. Call us as you need us. And of course, we can give you any more recommendations that we may make from that point in time. Thank you.